Welcome to Careers in Discovery, your window into the world of biotech leaders. On each episode, we interview the industry's leading executives to understand how they built their careers, what they've learned along the way, and the advice they'd give to their younger selves. This time on Careers in Discovery, we welcomed Jose Munoz-Olaya, Chief Scientific Officer of Valink Therapeutics. Jose shared his journey from eager intern to biotech leader, and we discussed the importance of mentorship, the power of teamwork, and why patience is key. I am back on Careers in Discovery, and I'm delighted to be joined by Jose Munoz-Olaya of Valink Therapeutics. Jose, welcome to the show.
Thanks for having me in. It's a great pleasure to be here talking to you today.
Fantastic to see you. Well, Jose, we always start by talking about what you're up to now. And at the beginning of this year, you formally joined Valink Therapeutics as their CSO. Tell us a bit about the work you're doing there. I'm really interested in what the next generation of ADCs looks like and how you're approaching the task of developing them.
All right. So Valink Therapeutics is it's a startup. We've been going on for a bit over 2 years. And really, we have a really amazing team of very driven scientists who've actually put all their brains together to come up with a very innovative platform that allows us to screen biologics, multispecific, bispecific, multivalent antibodies and ADCs in a very efficient and quick manner. So we can do thousands of different antibodies or ADCs in a matter of 1 week.
Oh, wow.
A bit over a week, depending on the assay that we are running. But I guess the reason I'm here, the reason I actually started advising Valink a few years ago, and I found this proposition so interesting, is that I'm a person who kind of likes to challenge the status quo. So I'm always thinking about how to do things better. Why does the industry, why do we do things the way we do? And how can we drive innovation? And I've been lucky enough to be through the journey of I started doing monoclonal antibodies, then moved on to do bispecific antibodies in T-cell engagers in IO. And one thing that I observed in this journey is the massive attrition in the targets that companies end up bringing forward to the clinic. So you have very powerful bispecific platforms that could be, essentially you have unlimited opportunities, and there is a kind of like this attrition and this convergence on very common targets. So if you look at everything that is biospecific after so many years of industry innovation, the targets are relatively limited. There are a bunch of very preferred tumor-associated antigens and immune modulators. And essentially, my point of view is that the industry have been through that evolution. We have actually learned a lot from building bispecific and multispecific T-cell engagers. And now we can actually leverage those learnings and that understanding in making things better. And that's where Valink and ADCs, antibody-drug conjugates, come in. This is not a new industry. ADCs have been around for a very long time, but very much like monoclonal antibodies, ADCs were relatively simple molecules with a simple payload, a linker, and a off-the-shelf, in some cases, antibody moiety, binding moiety, and with a very clear example of trastuzumab as HER2 antibody being the basis of the proof of concept of so many different players in the industry. So Valink brings everything together, like all these years of learnings and a very high throughput screening platform to really develop a new type of ADC. So I like to call them smarter ADCs, but really they are like the next generation of biospecific ADCs, where we actually look for new combinations that would not be obvious for other players.
Okay.
And because we leverage the high throughput screening platform in kind of like a weak end-to-end process, then we can actually evaluate many combinations, thousands of different combinations, and really come up with the molecules that really do the best in the most important assay, which is for an ADC would be kill the tumor cell.
Yes, I see. Okay.
And I think that's that's actually a lot of fun, and it's kind of like coming full circle for me. And
yeah, so taking that concept and improving on it and making it faster and giving it more utility and broader scope, with a focus on oncology currently, correct?
Yeah, so we are obviously an oncology company developing ADCs for oncology. We want to actually, we've chosen challenging oncology indications because we do want to make a difference. We don't, there are actually quite a few already very good ADC drugs in a couple of indications, like breast cancer, one of them. That actually there is very little reason going to the HER2 space, for example.
Yes.
So we've for our first few programs, we are focusing on challenging indications where actually we can bring something new.
Yeah, interesting. So taking on the tough stuff first.
Or you can say low-hanging fruit.
Okay, fair enough. Fair enough. And you joined, as you said, sort of, you'd been advising the company for a while, but you joined formally 6 months or so ago to take on the role of Chief Scientific Officer. Tell us, how have the first 6 months been? What have you been spending your time on? Yeah, tell us how it's been so far.
That's a very interesting question. So when I joined, obviously I've been advising Valink for a couple of years, but as the company last year went through a seed fundraise, we essentially created the foundations that we needed to transition the company from platform to a therapeutics company.
Yeah.
So inherent of this transition comes a very significant change in the scope of some of the teams within the company. So my first few months were pretty much, getting up to speed, yes, but getting hands-on with a strategy of how we were going to choose indications, how we we're going to design the first program, the second, third, and so on to build a pipeline. And a lot of my time was actually spent in recruiting. It's I'm building the team, the team that is assessing the early stage discovery process and then preclinical screening, preclinical development of the ADCs that we are finding.
Yes.
And it's been a really intense 6 months. I actually probably feel like I've been for much longer.
I'm sure. And, one of the things that I think people listening to this episode may be thinking about is, if they want to be a chief scientific officer one day, perhaps they're thinking about how to get into that role. And, clearly you had a connection with the company prior to taking on this role. Can you tell us a bit about how that came about and sort of the advisory role that you had and how you found your way to that?
Yeah, so I think this is one question that is very difficult to ask because people all take different routes, right? So
Yeah.
there is not a right or wrong answer. I can tell you that in my case, in one of my previous jobs at F-Star, I was principal scientist, and I was very eager to do more and to continue growing. And the F-Star was transitioning and had transitioned to a more clinical stage company. So um, my opportunities really were to grow within the clinical aspect of the drug development, or kind of do something else.
Yeah.
And what I chose to do was, as part of my job, I wanted to do something outside of work. So I have quite a healthy network of connections in the industry in Cambridge, some of whom you've obviously interviewed, and I thought it would actually be quite interesting to start advising people or as a
Yes.
consultant, obviously for free because I was very inexperienced. And then I started moving these things around. At the beginning, people didn't know me, didn't know what I could do. And actually, to be fair, I didn't know what I was doing.
Right. Yeah.
It was I was learning as I went along, and that kind of allowed me to meet a lot of people and grow my network. Um, and then after that, I moved on to a more senior role in Adaptate as the head of preclinical, and essentially my network continued growing. I kept meeting more people, and people I had met introduced me to more people, and that's how
Yes.
I got to be an advisor of Valink Therapeutics at the very beginning. Back then, it was mostly antibody discovery, but then I helped them devise kind of like a more thorough strategy on how to leverage the platform into making therapeutics and
Yes.
preclinical aspects of the platform. And really, it comes down to your network. And I guess the founders, the co-founders of Valink, sometimes make a joke that I had the longest interview in on Earth, because actually my job interview with them was like 2 years long.
Yes. Yeah. Yeah, but it gives you a great opportunity to get to know them, right? And for them to get to know you, and I guess it makes that transition when it comes much
Mm,
smoother and much easier.
yes, and been, I guess, talk to people, um, just talk about things you like. I'm a person who really likes to, as I said, challenge what we're doing, and think about the technology and how we can improve it with the concept of feeling or fulfilling those unmet clinical needs.
Yes.
And in the process, I do also what I like, which is working with people and mentoring, and seeing people grow within the roles. I think that's also something that I
Yeah.
find very interesting.
Yeah, absolutely. And it strikes me as well that you were looking proactively for things that A, were interesting for you, but also B, that you could help with, that you could be useful on.
Yeah, and like anything, so for some things I was helpful, and other things I wasn't, and that's
Sure,
okay
yeah.
because you don't always have the answers to everything.
No, no, absolutely. Okay, interesting. So I'd like to go back further now, and go
Okay.
back to the beginnings of your career. And I know originally you trained as a molecular biologist. Obviously, as
Hmm.
you mentioned, got quickly into different types of antibodies. But why, in the first place, why science for you, Jose? Why biology? Why drug development? What led to this career, do you think, for you?
That's an interesting one. So I'm going to go really back to
Yeah,
when I
yeah.
was in school, right? So I have a very varied family background, with people doing sciences, engineering, software development, medicine, languages. So I had like a lot of role models to
Mm,
kind of look up to. But the things that I was really passionate about were science, technology, and medicine. Um, but I was still like anyone in high school. I was very unsure
Right.
how that translated to a career, or even I wasn't even thinking about careers, how that translated to something that I wanted to study in university.
Mm-hmm.
And all of that changed when in my last year of, one of my last years of high school, I had a really good science teacher and she actually did her classes in a very, very interactive way. And one day we go to the genetic code, and she actually, it was funny. She also did computer science in the
Mm-hmm.
school. So she took genetic code pretty much like a biological program. And I found that absolutely fascinating.
Yes.
I had never realized that, how similar programs were to genes. And that brought together the two things I really liked, technology and medicine slash biology. So I started seeing a future in doing something related to genetics.
Yeah, I
And that's
see.
how I got to choose biotechnology at the University of Sussex. Of course, I did my undergrad in Brighton, but I didn't know how to then make a career out of that, like most people. So I actually took part of an industry gap year, a placement student internship role
Yes.
in Cambridge Antibody Technology in CAT. So that was very, very long time ago, when before the MedImmune and AZ acquisition. So that's how actually my career in antibodies started. I was a very inexperienced and young intern,
Yes.
and I essentially learned from many mentors and managers within the organization, and that's how I started in antibodies.
Yeah.
And from there, I moved to biospecifics, and then different types of biospecifics, and now I'm doing biospecific ADCs after a few
Yeah.
years.
No, makes sense. And that internship, so that was prior to your PhD, is that right?
Yes,
Yeah.
that was part of my undergrad.
Yeah, okay. And so what do you remember about that time? I mean, first of all, what a great place to do an internship at, right? But what do you
Exactly.
remember about it, and how did that influence sort of your decision then to go back on and do a PhD and get into the industry and that kind of thing?
That's funny because I was 20 years old.
Yeah.
I was super inexperienced. So,
Yeah,
I mean, I think sometimes people need to remember what they were like when they didn't know anything, and that's I don't want to forget that when I deal with people. Yeah, in 2003, I was very, very inexperienced. I was essentially my first real experience in a lab. So I was given a lab
yeah.
code, I was given a project, and I was told, you have to do this. I was, okay, how do I do this?
Yeah.
So I actually learned everything from a couple of people. I can, I can mention Steve Rust, for example. I learned how to do PCRs from him.
Okay.
So he was a really good mentor. Actually, probably he thought I was a bit annoying at the time with all my questions, but I did my best, and I did learn an awful lot of how to be a scientist in that year. So, if there's a take-home message for people who are even much earlier in their career in science, if they're doing their undergrad, I would so highly recommend doing a placement.
Right.
Or if you finished your undergrad or your master's and you're looking for something, and someone gives you the opportunity to join a company as an intern, just do it. You will learn so much.
Mm-hmm. Yeah. Yeah, I mean, there's no substitute for it, right? Being in there and being next to people that have been doing it for 20,
Yeah,
30 years and seeing how they operate
and you do make very lifelong connections and
yeah.
friendships along the way. I'm still pretty much in touch with a few of the people that I work with at that time.
Yeah. Yeah, absolutely. And so you took the decision to head to Barcelona, do your
Hmm.
PhD. And tell us a bit about that, and then how that led to your career proper in industry, I suppose.
So when I finished my studies, I realized that I knew a lot about proteins. I knew a lot about cloning and working in a biotechnology kind of like gene engineering environment, but I have kind of not done enough in the cell biology aspect, and oncology was still my preferred area of that I wanted to head into. So I was given an opportunity to do a very interesting PhD doing cancer biology, but also kind of there was a bit of a mix between virology, so HIV and immunology, cell biology. And I thought it was a good opportunity to learn new techniques, and actually it was very interesting because I was the first person to join the lab with a background in molecular genetics. So I joined a lab of cell biologists and organic chemists. And I did that for a few years. I started as a kind of like 1 year internship, then progressed to a PhD, finished it, and then stayed around for a few months, and then decided that my heart really was in antibodies, that I really wanted to go back to antibodies. With everything that I had learned, I really wanted to do more. And that's, moved back to Cambridge about 12, 13 years ago. And and then started working at F-Star.
Yeah, and the time that you were at F-Star, sorry, was quite a period of growth and transition for the company, and
Absolutely.
went through several successful phases of progressing programs and taking things into the clinic and all this kind of stuff. I mean, tell us what it was like when you first joined and where it was at, and then talk us through the sort of next few years there.
So I joined F-Star I think I joined a couple months after John Harum started as CEO. So it was still a very small team, but it was the first time the company was all under the same roof. So historically, there was a F-Star started in Vienna. There was a lab in Vienna. Then there was a biology lab in Cambridge in Randall Park. And then they opened up a new antibody discovery lab in Bebraham. So we were all kind of like in different places. And around that time was when everyone came together. So I actually joined the company at that time. And it was a big change. It was the first time in a long time that everyone felt like they belonged in one company, and that was developing really interesting techniques, really interesting antibodies using the platform that by that time had already been validated and made to work. So I kind of joined when everything was well underway to grow as a therapeutic proposition, but there was a lot of work in optimizing the processes. At that time we decided to go into IO. So we had our first generation of IO bispecific antibodies. We used those learnings to develop the second wave of IO bispecific antibodies. The one I specifically led was the CD137 franchise that actually is essentially the one with the highest probability of being a blockbuster drug right now. There are multiple variants of those antibodies in different partners, F-Star, Invox. They're taking it forward. Obviously, there's FS222 in the clinic, which is showing very good results from what I hear. So it was a big transition and a lot of opportunities, actually. So I remember on kind of like my second or my third week, John Harum and Mihir Pantuna sat next to me and say, "You're going to be a project leader." I was like, okay. How do I do that? So there was a lot of empowering. There was a
Yes.
lot of getting people to take on challenging roles and grow, develop within the company. So, my 8.5 years at F-Star actually were completely career defining for me. I owe everything to my mentors at F-Star, managers. I've mentioned John Harum, Miri already, but also Michelle Morrow, for example. Yeah, and that's actually given me the experience and the expertise and kind of like the sense for what we need to do when we are developing these very complicated molecules. And yeah, it was a very, very good ride.
Yeah, I can imagine. And you mentioned that, it was very formative for you and the real sort of driver of your career, that time that you spent there. You talked about some of the people as well. What are the things do you think that you learned there that stay with you?
There are a few technical things that I will never forget, obviously. I don't know if I'm a bit unusual with this, but I learned the power of people.
Right.
In this industry and in science, you have people who are very much knowledge driven, who have answers for everything, who are completely up to date with every scientific paper, and that's fine. We need those kind of people, obviously.
Yes.
We are in biotech. We are working towards helping the patient. Addressing those unmet clinical needs. We're not doing science for the sake of doing science. We are doing science, and we are developing these antibodies and these groundbreaking therapies to help the patient. But behind all of that is the people who do it. And
Yes.
I learned that I learned something that I never knew I had in me, and is that I actually like to. I'm very keen in mentoring people, in building teams and developing the people who are behind all of these breakthrough discoveries and sometimes not so great discoveries. There are good ups and downs and peaks and troughs in every research, but like who's always behind that is the science and the people doing the job. So I learned that, and I actually that's a part that I really enjoy about my job.
Yeah, no, I completely agree, and it comes up all the time on this podcast that perhaps people came into their career not appreciating how important the people that they were going to work with were going to end up being, but that they realize over time that actually that's the thing that makes it work or not, right?
And I think for me, because the people that I've already mentioned who were and who still are very much my mentors and my sounding boards. I also got the sense of, or like the feeling of paid forward, like they've had they are amazing professional scientists, business people who go the extra mile to help you. So your responsibility is to pay that forward. And the same way that Cambridge Antibody gave me the opportunity to be an intern so many years ago, I've given that opportunity of I've created internship jobs, I've hired junior people, and I've very much taking them almost like at the beginning holding their hands, but then seeing they take off and do things on their own and really grow within the role, within their career. And I have actually more than one example of people who started in my teams as interns, and now they're very respected leaders in their field. I mean, if you think about that, people who started as an intern and then they are principal scientists, associate directors, whatever, they are leaders in their field after these few years, it's actually so proud. Such a I have such a sense of pride in seeing them where they are now. So that's my way of kind of like paying it back in a way.
Yes. Yeah, no, absolutely. And I think we've always found that people have been super generous on this podcast, for example, in terms of helping people out and, each one teach one and that sort of concept, right? And it's really prevalent in this sector, I think. People really do want to help others and understand the
Absolutely.
struggles that they face because it's difficult work, right? It's a hard job.
But it's a fun one. It's a
Yes,
fun
that's
job.
true. That's true. That's true.
It's
And then, so next for you then was a step into a director role and in another sort of biotech, Cambridge biotech success story over at Adaptate, which became Takeda, of course, as
yeah.
part of its journey. So that maybe was a slightly different organization and a slightly different transition, certainly as it became part of Takeda.
Actually, so just one small correction.
Yes.
Adapted was in a London biotech.
London biotech. Apologies.
Not
Yes, you're
Cambridge.
right. You're right. Yes.
It was. I mean, if you think about it, I spent many years doing IO on the traditional immune populations, CD4, CD8, NKs, and yeah, that's all very cute. But then, I also wanted a challenge and I wanted to do something slightly different.
Yes.
And Adapted actually was a very interesting proposition because it was the premise was to apply these learnings on engaging immune cells on a very specific subpopulation of T cells called gamma delta, which have amazing surveillance and tumor killing properties. So it was a very niche population of immune cells, very slow numbers in blood and in tissues, but that have the potential of doing great things
Yes.
In terms of improving outcomes in patients. And it was I transitioned to essentially different biology. It was I was still doing immune engagers and preclinical development of those engagers, but just on a very specific subset of immune cells. That was it was a very good ride. We were also doing bispecifics, all sort of crazy ideas, and the most amazing thing is that actually we could see, it was very tangible, like what we were doing, like how we could actually make things better for some patients because of the novelty of these cells. Kind of at the same time, there were other companies doing T cell therapy on these gamma delta, either the subset that we worked on, which was the V delta 1s, but also cell therapy on the delta 2 subset. So there was a lot of momentum being built around gamma delta T cells at the time, and that what brought Takeda to to show like a big interest. I mean, there were already investors in the company, so they obviously had first kind of like in a way they knew what we were doing, right? So they knew the promising results, and they acquired us and Gamma Delta Therapeutics at the beginning of 2022. So that was also an interesting transition from very small biotech. I think we were 20 to being part of a huge pharma company, like 50,000 employees. But actually, we saw that we were part of a bigger team, but pretty much the same spirit prevailed of developing, making the right decisions, following the science, doing things for the benefit of the patient. So in that sense, the drive to bring these molecules to the clinic was actually very much the same, but obviously with much bigger resources and expertise at our disposal. So that was a very interesting way of seeing how big pharma can also complement small biotech
Yeah.
in terms of taking innovation forward into clinical development. And it's all synergy between different players. So there isn't a good or a bad player.
No.
There's a kind of like a symbiotic relationship between big and small companies.
Yeah, absolutely. And you mentioned that the spirit remained there, and sort of culturally the business carried on with the
Mm-hmm.
culture that it had. And that one of the things that Takeda brought was the resource and the knowledge and the expertise around other areas of development. I mean, what was that transition like, though? You know, how different was it? What obviously they'd been involved for a while, so I guess that helped. Um, and you mentioned that symbiotic relationship. You know, what do you think the bigger partner there brought to the table beyond just money, of course?
I mean, resources and
Yeah.
knowledge, right? So sometimes, you're developing a program and, you need some external advice and modeling or in toxicology or anything. And then big pharma actually have a big range
Mm,
of experts there just waiting to help and come on board on the program and give their expertise. That's something that obviously it's much more straightforward than going around trying to find consultants, external
yes.
consultants or advisors. So in a way, that knowledge transfer and that expertise collaboration is much more frictionless in big pharma.
Yeah, I see. So there's less barriers to finding those people and engaging
Mm-hmm.
with them. Yeah. Yeah, that makes sense. Um, and that leads us obviously back up to Valink.
Mm-hmm.
Um, and I suppose coming into this early stage company, you know, there was, I would imagine, some things already in place in terms of how the business was being run and how the culture was being created, and of course the science was already underway and things like that. But I suppose there's an opportunity there to kind of shape this from an R&D perspective into the image that you have in mind in partnership with the rest of the leadership team, of course.
Mm-hmm.
Looking back on, and we might have mentioned some of these already, but looking back on the experiences you've had in your career, how have those then shaped what you want to do with Valink, and particularly sort of the way that you want to build that organization?
Good question. I obviously there are many different ways of managing the teams and managing R&D. Um, I start with having the right team, right?
Mm,
Having the right expertise, and that's why I spent a bit of time at the beginning recruiting people um, to take on new challenges. I think as I said at the beginning, the R&D strategy was pretty much we had a goal of starting the therapeutic angle of the company,
yeah,
transitioning from platform to therapies, and we actually started everything from scratch. So I've done things in a way that I've taken learnings from my previous jobs, previous experience. So I'm very keen in being very mindful of what we are developing.
mm,
So we actually start backwards, right? So we start with what we want to treat. What is the
right,
indication that we want to address, or where is the unmet clinical need that we actually want to bring something forward for, and then from there we start with the indication, the different stratification of that indication, what targets we would be interested in. So, yeah, I brought the way I've done things in the past and how I've learned that things work better, and that's how I'm shaping the team and the
yeah,
organization. And I think if we couple that, having the right team with having the right culture, I mean, in 6 months we have achieved crazy things. So it's I'm seeing tremendous drive to do amazing science, and
mm,
and I think it's very encouraging. how everyone is actually taking on and transitioning as well, because all the people who were in the company before were developing the platform, and now they are starting to think about the big picture, right? So they are now seeing how their work in developing the platform is actually translating to a potential drug that we are moving forward. So in a way, they're also growing and seeing the output of the work in a very tangible way.
Yes. Yeah, I see. And that is rapid progress, as you say, which is great to see, which speaks to the speed of the platform and the capability of the platform for sure. And then I suppose looking at this a different way, if you went back to, I don't know, maybe when you were heading out on your internship at CAT and going back to that 20-year-old Jose who didn't really know what he didn't know and was trying to find his way in the world. What do you know now that you wish you'd known then, or what piece of advice would you share with your younger self?
That's a good one. I guess when you are so young and so early in your career, it's extremely difficult to know where you're going to go. So I would say trust the people who are helping you. They're doing it, they really have your best interest at heart.
Okay.
And it is okay to be led. It is okay to be mentored and to be steered. And help is okay. I would say, as you grow and continue a bit more, then you start connecting all the dots. And that's when you start noticing. But the main thing is just be patient. You don't need to do everything in one go. Things will come in, all the pieces will fall in the right place.
Yes. Just keep showing up and doing the work. And yeah, no, makes sense. And tell us a bit about, if you can, what's next for you and for Valink, and what the next 12 months holds for you.
So we are currently developing the first program, right? So what's next is build a very healthy pipeline of ADCs and go through proof of concept studies, and I think based on what we're seeing, I'm actually quite excited about what we are going to do next. I think the platform really, we are doing ADCs right now because that's a very clear benefit and
yes.
Use a very specific case for the platform. But we don't really have to be limited to ADCs. So actually, we could be thinking about having groundbreaking treatments for any oncology indication where we can explore synergistic target combinations that other people have not explored before. So really my dream is to grow and have essentially targets against every single TAA out there.
Okay.
And just find the best, for each specific indication, finding the right synergy and the right characteristics that would make that a groundbreaking drug for that indication.
Yeah, absolutely. So this is very much a long-term plan for you, and really want to see what the potential of this thing is.
Absolutely.
Yeah, fantastic. Well, look, it's a exciting year ahead. We wish you the best of luck with it, Jose. Thank you so much for sharing your experience with us. It was really insightful. Yeah, thank you for coming on.
All right, thank you. It was a pleasure.
Thanks for listening. If you enjoyed the episode, please like and subscribe and share it with someone else you think will benefit. And for more podcasts, videos, blogs, and insights, come follow me, Tom Froggatt, on LinkedIn, YouTube, Instagram, Medium, or TikTok. See you next time.